Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. We're continuing our series of podcasts taking a deep dive into the main priorities laid out in the Healthy Illinois 2028 State Health Improvement Plan. In this episode, we're focusing on the first of the five major priority areas in that plan, emerging diseases. Coming up, we'll be talking with Andrea DosSantos, Deputy Director at IDPH in the Office of Preparedness and Response. But first, we're joined by Dr. Arti Barnes, the Chief Medical Officer at IDPH. And Arti, thanks so much. It's always a pleasure to have you on the program.
Happy to be here. Thank you for having me.
Well, let's start by defining what we mean by emerging diseases. I think when we think of this, the most obvious example that comes to mind is COVID-19, which almost overnight went from something no one had ever heard of to something that was impacting everyone. But the emergence of a disease, I'm guessing, doesn't always have to be that dramatic. So how are we defining and applying that term of emerging diseases?
So often it really applies to communicable diseases or almost infections, but often you can also think of it more broadly about issues that really impact human life that may not even be infection related. Like if we suddenly start seeing a spike in overdoses from a new substance that hasn't previously been identified. But to keep it traditional, when we think of infections that as emerging diseases, we really think of something that hasn't been pervasive or seasonal to the point that almost everyone is aware of it. Some infections often, while they are in existence and humanity has been aware of them, they've never really crossed our shores or spread locally. So, for example, you may have heard of the dengue virus. That's been around, but more recently, in the past years, the first time there's been what's referred to as local transmission, or the virus passing from human to human in North America. And so when we see unusual patterns or a brand new version of an old virus, like COVID, or like novel flu that we call bird flu, then we really consider those as emerging diseases.
You touched on another example that I think is really on the top of many people's minds right now, and that is H5N1, often referred to as avian influenza, bird flu. Now, we see variations on the flu every year. We've seen other types of bird flu even in the past. So, what's unique about H5N1, and what has that meant in terms of how IDPH is responding to it?
Well, H5N1 has been around for decades, but when it infects humans, it has the ability to be really highly pathogenic. So it has the ability to cause severe disease. In the past, we have seen mortality rates as high as 50%. That means that, you have a 1 in 2 shot of making it. Thankfully, we're not seeing humans getting as sick from this current version that's been in circulation in the US right now. So we're very grateful to that, but we really need to be vigilant, learning from history just to make sure that flu changes and mutates and morphs very easily. And if should it become a little more aggressive towards human and human life, we are ready and prepared for it.
You made reference to something that is really kind of sobering to think about, that when we talk about emerging diseases, it may not be something that's completely brand new and unheard of, but something that we're aware of, but has been in other parts of the world or in other species, and now suddenly it's something we have to be thinking about right here at home. So, how does IDPH monitor for an illness that may just be starting to take hold? And how do you tell when a novel germ moves from being this kind of abstract threat to a real world matter that requires public health intervention?
Well, again, something I'm grateful for is our um, extremely robust communicable disease section. What we've set up in Illinois is a fairly strong surveillance system. So we expect that when some unusual clusters of infections are identified, that those will be flagged to us either directly from the healthcare system or through local health departments. And that's when we take the first step and start to investigate this cluster. It's like, what's causing this? Is this something new that we've not expected? Where do we test for this kind of infection? And so it starts small through local reports and pattern recognition that, oh, we're starting to see a pattern emerge. And of course, sometimes we have enough time to prepare and react. With COVID, we didn't have enough time to prepare and react. And it really started affecting humanity in a widespread manner, very hard, very fast, up to the point that the healthcare system and was also extremely burdened by this and had ripple effects on human health in general, not just related to COVID. Thankfully, for the most part, when we see emerging issues as happened with MCOX, we were able to identify it fairly quickly, identify the source, deploy vaccines, deploy preventative messaging, and fairly successfully got the outbreak, especially the 2022 outbreak, under control. And we're optimistic that for the most part, our surveillance systems and our mitigation plans work in that same vein.
As you've noted here, when an emerging disease does take hold, it certainly has the potential to have an impact on every aspect of our lives, just as COVID-19 did. So, understandably, it became a priority area in the State Health Improvement Plan. And as such, there were several goals put in place to address this issue of emerging diseases. The first of those says, quote, decrease disparate health outcomes related to communicable and emerging diseases. So, knowing that health equity is a big focus at IDPH, how does IDPH ensure equitable access to care and information when a new disease emerges?
That's a great question, Jim, and really important question because COVID showed us very in a very humbling manner how sometimes public health interventions, necessary public health interventions, can drive disparities and have people who are frontline workers, people who don't have options of working from home. They're the ones who are the most affected. And sometimes they can represent groups that are vulnerable from several societal pressures. And so the goal is now to really be thoughtful in every single public health policy and intervention. What I have seen both local health departments do, as well as funding from the federal level all the way down to state and local, is to really provide supportive measures, including helping with groceries, helping with funding people's quarantine and isolation when they cannot afford to go to work and they're economically vulnerable. I have also seen great thought towards messaging. And IDPH embodies that philosophy that even if a certain infection may disparity target a specific group, that our representation of which groups are affected is given enough thought that we're not creating stereotypes that are negative and causing antagonism towards any vulnerable group. So, both in terms of our interventions, in terms of our messaging, and in terms of our mitigation, we are keeping that in mind, having learned some very, I think, humbling and harsh lessons for COVID about making sure that no vulnerable group gets specially targeted either through public health messaging or policy.
Dr. Arti Barnes, Chief Medical Officer at IDPH, thanks for getting us started in this important conversation about emerging diseases here on This is Public Health with the Illinois Department of Public Health. Of course, in dealing with emerging diseases, it's about more than just responding to them when they arise. A big part of IDPH's approach to this has to do with readiness, preparedness. And for that aspect of this discussion, we now welcome to This is Public Health Andrea DosSantos. She's Deputy Director at IDPH, overseeing the Office of Preparedness and Response. We call it OPR around here. And Andrea, thanks for being here with us.
Thank you, Jim. Glad to be here. So OPR has been a core program at IDPH since 2002, and we're dedicated to strengthening public health and healthcare preparedness statewide. Our focus areas include disaster planning, preparedness training, stockpiling of supplies, conducting exercises, evaluating responses, and then, of course, making improvements based on lessons learned. We also administer federal preparedness funding to 95 local health departments and 10 regional healthcare coalitions to enhance response readiness across the state. As you mentioned, we use large events as a way to practice our incident management capabilities, and these are essential for testing, evaluating, and improving our plans and processes before an emergency occurs. And back in 2024, we utilized the solar eclipse and the Democratic National Convention to practice our Public Health Emergency Operations Center plans. Our office prepares for all types of emergencies, everything from natural disasters to bioterrorism to radiological incidents. However, the hot topic of late is emerging infectious diseases, just due to all the responses we've had, COVID, Mpox, now the focus on H5N1. Some of the preparedness strategies that we have in place is collaborating with our Office of Disease Control, our Public Health Lab, and many others across the department to ensure, their expertise is in our planning process for these types of events. Some other strategies that we do is stockpiling of supplies, equipment, and medications as resources allow. We train staff to supplement our workforce, putting in place and practicing our response structure. We ensure alignment with state, local, and federal emergency management agencies, and we have to do a fair amount of contingency planning. So making sure that we have contracts, MOUs, and agreements with other agencies so that we can scale up quickly.
We're focusing on emerging diseases as one of the key priority areas in the State Health Improvement Plan. That plan not only lays out priorities, but also puts together goals to try to address some of those issues. And among the goals created to address emerging diseases in the SHIP is one to, quote, increase community resilience to communicable and other emerging disease threats. What does that entail, and what does OPR do to help communities prepare?
So as I mentioned, we work with a network of local health departments, healthcare partners, as well as regional staff across the state, and there really are boots on the ground when it comes to working with communities and enhancing their preparedness for health related emergencies. Some of the work that the folks do on the ground include things like they train healthcare workers for emergency response through programs like the Medical Reserve Corps. We have 67 active units of volunteers across the state of Illinois. They ensure that we have local distribution plans to get vaccines, medicines, and supplies out to communities. Another area that they work closely with communications on is developing culturally sensitive messaging to go out to folks during an emergency. And they also assist communities in accessing post disaster benefits and assistance programs.
Another goal is to strengthen and improve public health system infrastructure and coordination. What does that mean, especially in terms of getting ready for the next emerging threat?
Well, I think the coordination part is easy and is really part and parcel of the work that we do every day. No health department can respond to an emergency all alone, and we rely on critical partners such as emergency management agencies, first responders, the healthcare system, nonprofits, and many other federal, state, and local partners. And this collaboration is really essential for our planning and response efforts. Building up infrastructure is more of a challenge as it requires, significant investment, which is not always readily available. We often get an influx of funding when a disaster happens to address those short-term needs, but that does not, always address some of those longer-term systemic capacity issues. Some improvements that have been driven by recent emergencies in terms of infrastructure, though, are more of a focus on utilizing better tools and technology, and that can be for things like tracking diseases. It can be for sharing information more quickly during an emergency. Enhancing, our public health lab capabilities is really important, including increasing, their testing capacity during a disaster, especially, an emerging infectious disease. Training our workforce, as I've mentioned, that stockpiling, keeping critical supplies available. ensuring that resources and care are available for all, particularly for those that may be at higher risk to the impacts of a disaster. And really just being more proactive, through early detection, making sure that we're prepared to act immediately when a threat arises, and also, most importantly, making sure that our plans are flexible. No emergency is the same, and so we have to constantly adapt, based on the situation.
Definitely reassuring to know these plans and partnerships are in place to deal with emerging threats, even as the work continues to strengthen them. I want to again thank our guest, Andrea DosSantos, Deputy Director over the Office of Preparedness and Response at IDPH. And of course, earlier we heard from IDPH's Chief Medical Officer, Dr. Arti Barnes. Thank you all for being here as well. Next time, our focus will be on another priority area of Healthy Illinois 2028, chronic diseases. Join us for the next edition of This is Public Health with the Illinois Department of Public Health.